welcome in. Just have a seat for me. I'm Dr. C. It's so nice to meet you. So tell me what brings you in today. Okay. And how long has that been going on? Are you currently taking any medication for those symptoms? Okay. And do you feel like the symptoms have gotten worse, or are they kind of staying the same? All right. So I just need to ask you a few personal questions, and then we can go ahead and get started. So the first question is, what is your date of birth? Okay, what's your age? Do you smoke? Okay. Do you drink alcohol? Okay. And are you married? Okay, have you been out of the country within the past 30 days? Okay. And have you had to go to the doctor or the hospital for any reason in the past 30 days? All right. Are you on any other prescriptions? Okay. How many milligrams? How long have you been taking that? Okay. Do you have any asthma? Okay. What about allergies? Okay. And are you allergic to anything? Okay. All right. So, do you have a job that works with kids? Okay. The reason I ask is because it is the flu strep season this time of year, sadly, and when you are around kids more, it tends to kind of take a toll on your immune system. So them coughing on things, sneezing without, making sure they're not rubbing their hands all over everything. And of course we touch it, and sometimes we forget to wash our hands, so I just wanted to make sure. And do you have kids of your own? Okay. Alright. So kind of tell me, what are your biggest symptoms that you're noticing? Okay. Kind of like a fullness feeling in your ears? Okay. Is your throat bothering you at all? Okay. So what I want to do first, I'm going to put my gloves on just to keep both of us safe from anything that could be going on. These things can be tricky to get on sometimes. Just give me 1 second. Okay, so I just want to kind of feel around, see what's going on, make sure nothing serious is going on. So what I want to do first is kind of feel around your ears and your throat first, okay? Can you lift up your neck for me and kind of feel on your throat? Okay, if I press right here, does that hurt? A little bit? Okay, just sore. Okay, and what about this side? So your left gland does feel a little swollen to me. Which normally what happens is if you have any bacterial infection or your body is trying to fight off anything, it will normally get very puffy right through this area. That is because if you're having a lot of mucus or anything, your sinus cavity will actually create your mucus to drip down into your throat. And it can cause a lot of issues. So you could be just having some sinus issues, or it could be something more along the lines of like strep or the flu. So that is why I'm checking everything to just really make sure that we diagnose you correctly. Okay. Next, I'm just going to be checking in each of your ears to kind of see if there's any fluid buildup, and that'll give me a better idea of what's going on. So I'm going to start with this side first, okay? Yes, I see a little bit of fluid in this ear. I'm going to check your other ear now. Okay, yes, both of your ears do have some fluid buildup. I'm actually dealing with that myself right now, so you are not alone in that. Okay, next I'm going to take your temperature just to make sure that you don't have a temperature, because if you do, that normally is a sign that you are fighting some type of infection. So just open your mouth for me really quick, say ah. Just going to take 1 second, so be patient with me. Okay. You do have a low-grade fever. It's at 99.9, so it's not super high, but it is over the normal temperature. So it does mean your body is fighting off something. Okay. Next, I want you to open your mouth for me. Just gonna kind of look and make sure there's no pus pockets or anything sitting back there that could be causing more issues. So open, say ah. can open a little bit wider for me. Okay. I do see a few pus pockets on both sides. So that would explain why your throat feels sore. Yes. Do you get strep often? Okay. Right, next I'm just going to listen to your breathing and to your heart to make sure that you don't have any fluid in your lungs and that your heart sounds normal. Okay, so first I just want you to breathe normally, and then I will have you breathe in and out with deeper breaths. So just breathe normally first. Okay, good. Good. I'm going to move to your back. Good. Good. Okay, now what I want you to do is take a deep breath in and then deep breath out, and I will keep moving this around you. So deep breath in and out. Good. Again, breathe in, out. Good. Again. Good. One more. Okay, I'm going to move to your back. Breathe in, out. Good. In, out. Again. One more. Okay, very good. Everything sounds very normal with your heart and your lungs. I don't hear any fluid in them, so that is good. Okay. Last thing I want to do is check your blood pressure. So I'm just going to wrap this around your arm. Do you care which arm? Okay, perfect. Just stay as still as possible for me. You doing okay? Okay. Okay. Blood pressure was normal. So what I think is going on is that you have some early signs of strep. So I'm just going to prescribe you some amoxicillin to help. And do you want to do a steroid shot? It's not necessary, but we do offer it just in case. Okay. I'm going to give you a 10-day supply, so I want you to take one in the morning and then one at night. And make sure you don't miss any of the doses. And Make sure you're drinking plenty of fluids, especially water. And a lot of hot teas and hot water with lemon will help kind of break up the mucus and stuff that's in your throat. And I want you to take 1 to 2 days off of work, depending on how you feel. And just get as much rest as you possibly can, okay? Is your pharmacy still the same? Okay. This medicine should help, but if you are starting to see any other symptoms or your symptoms getting worse, please come back in and we will reevaluate you. So I'm just going to write a slip for your medication, and then I will send it off to your pharmacy, and it should be ready within the hour or so. And you can go ahead and take one now and take the other one before bed. Alright, well, I think that is everything. I hope you feel better. I know it's no fun being sick, but this medication really should help boost you up and make you start feeling better. Yeah. And I put my personal phone number on here just in case, and I will be calling you sometime tomorrow to check up on you, okay? Yes. Alright, well, I hope you feel better and have a great rest of your day, okay? Alright, see you soon.